Hey, this is Doug Fiedel along with my co-host Brent Mason, and welcome back to this segment, Healthcare Consumerism Radio. Obviously, a lot of the talk in the industry is about private exchanges and all the various models and the adoption of the projected adoption. And joining us talking about what they're doing in this space is Veer Gidwaney with Maxwell Health. Veer, good morning.
Good morning.
Hey, good to have you on the program. Thanks for joining us.
Thanks for having me.
Hey, give our audience, to start out, a brief backgrounder on Maxwell Health and your position in this private healthcare exchange market.
Yeah, good question, and I don't mean to pop the balloon on the conversation, but I wouldn't limit us to the private exchange market. I think that's a bit of a strict definition. Ultimately, what we're trying to do at Maxwell is to serve the consumer, and to that end, our aim is to be their passbook for health. When the customer has any question to do with their health insurance, their health care, we want them to think of the Maxwell app on their phone. Now, in order to make that happen, we are a private marketplace. We think of it more as a marketplace than an exchange, so to speak. And in that marketplace, you can get a whole range of products, obviously insurance and benefits-related products, but beyond that, other kinds of services that people and families need every day to live well. We built in a deep benefits administration system, which makes this a solution that benefits advisors can bring to their clients. And we see it as a very comprehensive healthcare engagement platform in the sense that, from the previous conversation around wellness, there's a whole wellness system built into Maxwell. And at a broad level, the way we think of ourselves is that we are an operating system and a platform to make employee benefits simple. No matter how you cut it, an individual or a family and an employer, by extension, is going to have to deal with a lot of different services and products in order to make their benefit strategy work. Our aim is to put a layer in front of all of it so that for the consumer, it's simple. It's one interface. And that allows us to use data really intelligently to make your medical insurance product talk to your Fitbit and talk to your life insurance product and talk to your subscription for childcare services, so that all of those different services and products are smarter and better in how they serve you. So that's what we've built, and we take a very broad view on how to be disruptive and game-changing in this space. Well,
I think that's very important. We talk about I'm not going to limit you here, but we talk about the successful private marketplace, private exchanges, whatever label we want to put on, are those that really truly can execute a complete benefits and health experience to the employee consumers.
That's right, and our purpose at Maxwell is to transform healthcare in America. Our purpose is not to make Ben admin better. Our purpose is not to help you buy products faster. Our purpose is to make healthcare better. And when you start with that, you realize that you clearly have to make benefits administration better, and you clearly have to make the marketplace really effective. But then you also appreciate the fact that the hardest part about dealing with benefits in the healthcare system comes after you've bought the benefits. I'm a father of two little kids. I live in New York. I've got a 4-year-old and a 2-year-old. And my real challenges are, hey, where do I go when my kid is sick? What doctor do I see? When I get a bill from that doctor, do I know that it was accurate? Should I pay it? When my nanny is sick, who do I call to get service so I can go to work? So those are the things that Americans in neighborhoods across the country, lose sleep on. They lose sleep for a few days when they choose benefits once a year, but other than that, it's done. And the real hard part is how do I make use of all of this?
Now, Veer, this is Brent. You had mentioned just a few minutes ago that you look at the broker consultant market as your distribution partner. Do you look to talk to the employers? Do you look to talk to health plans? Do you look to talk to third-party administrators who are working with self-funded companies as well?
Yes to all the above, except for one thing. So we generally don't work with employers directly, although the experience we create touches them, and ultimately we view their employees as our primary customer. But in terms of our platform, it can go to market in many different forms. So certainly today we have some tremendous broker partners across the country, 5 of the top 100. We've grown aggressively, 400% between Q4 and Q1. We'll grow another 50% this month alone. But on top of that, we've certainly had a lot of interest from TPAs, from PEOs, from health insurers, And I think there's a lot of ways that we can bring our product to the employer. Our ultimate objective, again, if you're going to try to transform healthcare in America, you need to have scale. Because unless you have tens of millions of people using a system, you just can't really make a dent in the system. And so that's why we think very broadly about how we go to market. And there's lots of ways that employers are going to engage with, call it private exchanges or marketplaces or benefits administration systems or mobile experiences or wellness experiences. There are lots of ways you're going to find them. And we want to be thoughtful about being a part of several different channels that make sense.
Yeah, and I know and this was early on, probably 2-3 years ago when the private exchanges, and then again, not to limit you to that term, but private exchanges, when they were coming about, there was a big question on whether or not the brokers, advisors, consultants a little bit different because they started buying exchanges, but the broker advisors were going to remain relevant. And as we look at it today, they're very relevant, much to what you're saying. What is, how do you help that broker who, one, is very knowledgeable about the shift that this market's making towards healthcare consumerism, and then how do you help that broker who maybe has, for lack of a better term, their head in the sand about where this market's moving, and how can they adopt your platform?
Yeah, great question. So let me get to the how in a moment, but let's talk about the why should they care. And there are a few things. One, at a very simple level, the vast majority of employers in America still interact with benefits on paper or in a very low-tech way.
Yeah.
If you imagine this industry 3 years from now, no one in their right mind can imagine that paper-based low-tech system still existing.
Right.
It's going to go away.
Right.
So that's the first reason I think of something like Maxwell. The second thing is that today the broker's relationship is primarily with an HR manager or a CFO in a good situation. We want to take that relationship beyond those two people and make it one with every employee. Mm-hmm. And for the first time ever, we give the broker the ability to touch the employee every day after they've bought their benefits. Mm. The third thing is we give them a differentiator. So, for those benefits advisors who look at Maxwell as core to their strategy, they get to walk into the boardroom and not only talk about their expertise in benefits, but they get to talk about how they're going to create an incredible consumer experience. And when they show that CFO a 3-minute Maxwell video, that CFO is going to look at that benefits advisor and know that they have their mind in the future. And that CFO wants to be in the future. They don't want to be in the past. Right. And I think that broker is going to be more likely to win. Right. Now, those 3 reasons are good enough reasons to think of something like Maxwell, but there are 3 other reasons that I think are even more important in the long term. One is that, and you're right, the benefits advisor has survived, and I think all of the talk about whether they would was not well placed and well thought out, and it's clear today that they have a very important role to play. But I think that we can't stand on our laurels. I still think that we face an existential threat. That unless we evolve our model fundamentally, how we sell, how we market, how we operate, we're going to continue to face threats down the road. And so, we want to help the broker reinvent their business. In fact, in many ways, we want them to see us as their e-commerce strategy, the front end and back end of how they interact with employers and employees. And finally, and this is the kicker, we actually make brokers money.
Yeah. Right.
And we make the money despite the fact that they typically finance the platform for their customers. And it's easy to make, I think, though good but somewhat subjective arguments around, you'll be more competitive, you'll retain your customers more effectively. Obviously, we help them do all of that, but they will literally make money on our platform. And the reason that's the case is because of 2 things. One, we have a very broad view of what a benefit is. So you'll see in our upcoming launch this summer a very wide variety of products in our Amazon-like marketplace to buy benefits. In fact, we believe in the future you will subscribe to health in the same way that you subscribe to entertainment. So today, people subscribe to Netflix and Spotify, and that's entertainment for me. That's all I need for my music and movies. In the future, you'll subscribe to health. You'll pay one price for your family, maybe a slightly lower price for a couple, and for that single price, you're going to get a suite of services that'll include not just medical, dental, vision, life, disability insurance, but it'll also include a will writing service, an emergency child care service, a wellness program to help you take classes for yoga, et cetera, et cetera, et cetera. You'll get all that from something like Maxwell. And so how do we make the broker money? We've gone out and negotiated relationships with our partners that enable the broker to earn a margin whenever those products are sold.
Very interesting. Well, Veer, we got about 30 seconds left, and let our audience know how they can find you guys. And very interesting stuff. Love what you guys are doing.
Thank you. MaxwellHealth.com. We'd love to talk to you and help you think about how we can serve your customers really effectively.
All right. Thank you so much, Veer, for joining us today on the program. Have a great long weekend. And to the rest of our audience, we will see you next Friday on Healthcare Consumerism Radio.